My name's Amandeep and I'm a refractive optometrist based in Harley Street, and I've been working here for 4 years now. The excitement of something different than your day-to-day optometry, so working alongside surgeons, just being in a surgery centre and not having to do your regular eye test routine, you're doing something different, consulting patients for surgery, which is like lifelong, and really seeing that rewarding outcome that they get. So that kind of was why I was interested in a provider that does everything. I help out with the post-operative checkups, so 24 hours, and general checkups as well, because we're a surgery centre, so we get a large bulk of that. Consultations is my main focus of the day, so patients coming in wanting to see their suitability for treatments, and also working alongside the surgeons. We get a lot of that here in Harley Street, being a surgery centre, so if there's any queries or any patient management, we work alongside each other, and we get to learn new skills, new techniques that they're using, and how better to manage our patients. Favourite part of the role is just the learning. I love learning new skills and just knowing more and more about eyes and like my role. So I've always been that way. I always like to just not kind of do the same thing day in, day out. It's humbling to know that there's always something more to learn. The worry is always, have I maximised my potential in a role? But definitely I don't feel that that's been the case, so that's nice to know. Every day is different here. Some of the patients that come in for consultations, you see with the different scans we have, we get lots of different eye conditions sometimes picked up. Just now I had a similar scenario to that, where a patient wasn't really having many issues, just that they had a bit of a prescription wanting to get rid of it, but actually we found that there is a condition of the cornea that he has. So highlighting that, he's now aware and it can be better managed. It's fulfilling to know that we've been able to help that and highlight it, whereas without those scans, definitely wouldn't have been able to discover that. I've had a lot of support in development. So when I first joined, I was up in head office in Glasgow with some of the main team members, learning the role, and that was really rewarding to get to know them and how they work. And also I've done the independent prescribing course with Optical Express as well, so they've funded it and also supported me throughout it. Just having that since I've joined has helped me immensely in the role, and just become more well-rounded and pick up new skills on the way. So and the clinical services team is fantastic. They're literally a phone call away, and again you may be using that a few times a week, and again just bouncing off another optometrist, which is hard sometimes. In normal practice you don't get that opportunity, whereas we do. We've got one of the best sets of technology that's available on the market, to be honest, and it's not just in one area. It's very well rounded. So having the Pentacam, just now picked up a patient with his cornea wasn't 100% as we would expect. Never would have picked that up on a regular eye test scenario. You can pick up just subtle conditions using that. We've now got the Claris, which is absolutely amazing because you get a full wide range view of patients' eyes. OCT, we've got that available, so we definitely know we're not missing out on any conditions at the retina, because a lot of them can be very subtle, and again you're not worried about missing crucial information because it's so obviously there. And it helps with our management as well with patients after surgery, and just to know, are conditions getting worse? Are they getting better or staying the same? So it makes us so much more confident in what we're saying. The way Optical Express have given us the opportunity to use this, not only is it beneficial to the patient, but just us as employees and as optometrists, we have all the skill sets we need because that data is behind us and all that information. And last week we had a patient who had a Visions were fine, had surgery with us a couple of years back, but just noticing new symptoms, and just through those scans, we were able to refer him same day for an issue with the eye. And I touched base with him 2 days later, and he told me he had a small brain tumour. And so he was really thankful that we picked that up, but definitely without my scans, it may have been something we missed. So really crucial, and he had been for eye tests elsewhere, but just having that helps me make that confident decision that that's the right thing to do. So very rewarding. As soon as I knew I was expecting, the team were all really supportive. Regional manager was messaging me, making sure I was okay, sent me a small care package, which was really nice. It's a nice touch. The management have been fantastic. They've just always checked in with me every couple of weeks, make sure that I'm happy, my workload's okay for me, and they've allowed time where I can catch up. Because of the support I've had, and I just love working here, it's just motivated me to just keep going. So no, they've all been really, really supportive, and each morning in our briefs they always ask, is there anything more they can do for me? How am I feeling today? So yeah, of course, it's fantastic to be around that, and that's why I don't want to leave it. Joining Optical Express is a whole new world in a good way. So if you are somebody who wants a challenge, you're bored of your day-to-day routine as an optometrist, you will not be bored here. So it's satisfying, just the opportunities we have, the things we see, it can vary so much. And so definitely try Optical Express. Like myself, I've been here 4 years, but I've still feel like I'm new to it all. Yeah, you're still confident in what you're doing, but you're just learning, and there's always something new going on. I would say there's no harm coming in and having a chat with us, have a consultation, find out what your options are. Most likely we'll be able to offer you surgery within a few weeks, and you can go back to driving your day-to-day, especially if you're very independent, which a lot of patients are these days.